Hi, Esosa here. Thank you for watching another episode of one of my health campaigns. Today I'll be talking to you about a disease which kills one person every minute and about 2 million people yearly. It is a disease that some people sadly believe belongs to the past. But unfortunately, the truth remains that this disease is still very much here as it was many decades ago. It is called tuberculosis. I experienced it firsthand, and I'd like to share my story as I've always done in the past. However, today I've decided to do things a little different by not just telling you of my story and hoping you will get some insights, but also reading to you stories about two other ladies who experienced TB and what they went through. I've extracted these stories from the Truth About TB website, so please bear with me as I delve in. The first one is about Amy. And it says, as a young student, Amy's attention was on her studies and nothing else. She thought the BCG vaccine she'd had as a child would protect her from what she considered a disease of the past. Not knowing the symptoms of TB, she was never on the lookout when she got ill. She was never on the lookout of it when she got ill. These factors and the delay in diagnosis led to Amy's TB becoming life-threatening. In April 2004, I got antibiotics from the doctor for a dry, itchy cough. I was a busy 24-year-old law student and thought my illness was just about stress from my studies. But over the next 3 months, the cough got worse and I lost a stone. So I went back to the doctor and I got some more antibiotics. The only person who mentioned the possibility of TB to me at this stage was my uncle, but I didn't take it seriously because I had had the vaccine. From September to December 2004, I got more tired but carried on. When I went home for Christmas, everyone noticed my weight loss. My doctor referred me to hospital, and around January 2005, I started to get night sweats. My hospital appointment took 6 weeks to come through. I had an x-ray but had nothing. And then in April 2005, the hospital did a bronchoscopy and sputum test, and I was diagnosed with TB. By this time, I had dropped from 8 to 5.5 stones. I was put on a TB treatment plan. I have to admit that I didn't start taking the tablet for 3 weeks because I was so scared of side effects that I had read about and had been told about by my nurse. A month after my diagnosis, an x-ray showed that one of my lungs had collapsed. A couple of weeks later, I was in hospital for 2 weeks and given some physiotherapy to help my lung. I finished my treatment in January 2006 and was given the all clear. About a month later, red circles appeared on my legs, so I went to the county hospital. My heart rate was high, a consultant took samples, but I had nothing for 3 weeks. Eventually, I returned to my doctor who gave me more antibiotics. My cough came back and I began to feel sick, tired, and lost weight again. That May, I went back to my doctor and I was given an emergency appointment for the chest clinic. But before this came up, I was admitted to hospital with a pneumonia-related infection where they found that my TB had reoccurred. Because my lung had collapsed, not all the bacteria had been killed off. In May 2007, I had an operation to remove my lung. Thanks to my family, friends, and medical staff, I got better and I caught up with my studies. When I was diagnosed with TB, I was surprised, as I thought, it is a Victorian disease. But I was also relieved because I thought I had asthma. I didn't think I could get it because I had taken the BCG vaccine and I wasn't coughing up blood. Now I know what signs and symptoms to look out for. Does that story ring any bell? Does it sound familiar? Or is it all new to you? Well, Amy has told you the truth. TB is still here. It hasn't gone away, unfortunately. The mycobacterium is everywhere and is no respecter of persons, to be fair. However, The good news is it is curable. It is curable. And we need to be able to identify the signs and the symptoms early, at an early stage, so that it doesn't get to a point like it was for Amy, where her lung collapsed. She overlooked the symptoms she was having at the time, and unfortunately, the mycobacterium had done a lot more havoc in her body. She started a course of treatment, and she felt better, and she stopped. Which brings me to actually highlight the fact that when you are being treated for TB, it is important you finish the course of your treatment. It's important you take all of the medication that has been prescribed to you for however long. Most often it is for 6 months. It could be for longer, depending on how badly affected your body is as a result of the TB. But back to my main point in Amy's story, which is the signs and symptoms of TB. From what she said, the main signs and symptoms of TB, not just from what she said, the main signs and symptoms of TB are actually cough. For some people, they may cough out some blood, others may not, but persistent coughing. It could be weight loss, and dramatic one for that matter. Like Amy, she lost from 8 stones, she came down to about 5.5. Another symptom is night sweats. These are the main signs and symptoms of TB. It could vary for other people, especially depending on where the TB affects. But for pulmonary TB, which is TB which affects just the lungs, these are the main symptoms you would have if you were infected by the mycobacterium. And that's Amy's account. Luckily, her life was spared, although she had to lose one of her lungs. It doesn't have to be same for you. Are you having similar symptoms and you're overlooking it? It just might not be TB, but it could be TB. Have you been to your doctor and they said, oh, it's nothing? Go back. Ask to do some more tests. Get them to do a sputum test. Get them to do an x-ray or a bronchoscopy test. I can't even pronounce the word like Amy had. All I'm trying to say is, do not ignore it if you're having the symptoms. Knowledge is power. Had Amy run with the suggestion from my uncle at the onset that, Amy, you just might have TB here, she probably would have ended up in the way she did. Now, that's Amy's story. I have my own story, but before I tell you my story, here is another account of someone else called Natalie. Natalie, a young woman with 2 young children, was relieved when she was told she had renal or kidney TB, because she finally knew what was wrong with her and that it could be cured. In 2004, while pregnant with my first son, James, I started getting pains in my kidneys. At first, the hospital thought it was just appendicitis, but they couldn't find anything wrong. I was in hospital for about a week, but when nothing was found, I was told it was a pregnancy-related illness and so sent home. I was told to take paracetamol for the pain. After James was born, I kept getting what they thought was urinary infection. They gave me some antibiotics, but it didn't seem to make me any better. In 2006, when I was pregnant with my second son, I went into hospital again with kidney problems. They said it was pregnancy related again. By this time, I could hardly walk. I was scared the doctor wouldn't believe me. Sometimes I just didn't bother going to hospital because it never seemed to get me anywhere. The nurse practitioner was the only one who listened. I said, I know my body. I know there is something wrong. It shouldn't hurt that much. It was the nurse who eventually tested me for TB. She didn't even know it could be somewhere else other than the lungs. But she had tested me for everything else, and the doctor she knew suggested she tested for tuberculosis. She said, you've had BCG, so you shouldn't have TB. But I did. I was told that I had TB in my kidneys. When I asked what would happen to me, they said it was curable. So I didn't panic, thinking that I would die or anything. I just got on with it. Finally, knowing I had TB was in some ways a relief. At least it is curable. I was on my antibiotics for 6 months altogether, I found it really hard taking my medication. I don't like taking tablets at all. And I didn't like the side effects. I felt sick, I got heartburn and a rash all over my face. And I had this horrible smell that I couldn't get rid of. I thought my house smelled. I even disinfected everything. I was really ashamed if anyone came around. But it turned out that only I could smell it. And the nurse said that that was the side effect. It was just the tablets at work. A few times I would think, today I won't bother. I won't take my medicine. But then I would look at my kids and think, no, I've got to take them. Because my doctors have told me that if I don't take them, if I don't complete my medication, I'm more at risk of the TB reoccurring. You know, you don't get TB from being poor. You don't get TB for any other reason than you just happen to get it. That's just life. But it is curable, and that's the main thing. Because a lot of people think you die from it straight away. But you don't. I am still here. Of course you are, Natalie. I'm really pleased to read such stories about other people because it just helps to create more and more awareness about this disease. It's interesting to see that Natalie said that initially her doctors or the medical staff that attended to her thought it was pregnancy related. That's the same experience that I had. I remember in the last trimester of my pregnancy when I kept complaining about pains in my back, pains in my chest. Nobody would listen to me. Please, for them to leave me days after I had my baby fell on deaf ears. I was told to go home, that I might even feel better. All in the name of, this is how it is when you've just had a baby. Well, I didn't know better. I had never heard of extrapulmonary TB, which is TB that affects places in the body outside the lungs. So similar to what Natalie had. So I went home, but I got worse and worse. At a point, I lost sensation in my legs. I couldn't walk anymore. And that was when I realized that, no, come on, this cannot be pregnancy related. I know that I'm a first-time mom here. However, this is not just right. Like Natalie said, it's my body. I could tell things were not right in my body. If I was getting progressively better, that would have been something. But I wasn't. I was getting worse and worse. I was out of breath. I was in so much pain. I couldn't do anything. I couldn't bend forward to change my baby's nappy. I couldn't really do anything for him, let alone myself. I couldn't do anything for myself, let alone my baby. I beg your pardon. And eventually I had to get back into hospital, and there it was discovered that my spine had collapsed in about 4 or so places. So 4 of my vertebrae had collapsed. It was the shock of my life. I remember arguing with my surgeon that no, I can't have TB when he told me that he suspected TB. This was before he had done some test out of a sample he took from my spine, when he had to, of course, carry out an emergency surgery on my spine. Anyway, this is 9 years down the line, and I still find people who don't know much about the variants of TB. TB is of 2 main types. It's either pulmonary or it's extrapulmonary. Pulmonary is more popularly known. However, it's not the same for extrapulmonary TB. As a matter of fact, about a couple of weeks or 3 weeks ago, I met an old friend of mine who, the last time I met her was about 8 years ago. At the time, she didn't know that I had just recovered from TB. So when I saw her, I said, oh gosh, meeting you really brings back a lot of memories. And she said, oh really? What memories? She thought I was referring to just seeing her and, thinking of the old times. And I said, well, that's on one hand. However, this was what happened to me just before I met you guys. And as I began to recount my experience of tuberculosis to her, her husband was also there. Both of them stopped me in my tracks and said, say that again. Do you mean TB can be anywhere else outside the lungs? And I was, in a way, happy that I was meeting more and more people who didn't know about TB being extrapulmonary, because that was the same experience I had 9 years ago. I was born and bred in Nigeria, which is TB prone, TB endemic. And so I felt I had all the basic knowledge of TB being a disease of the lungs. I thought it started and ended in the lungs. But how wrong was I? And that was why when the surgeon whom I met a month after being told to go home from the maternity ward said, I suspect you have TB, Esosa, because I've treated patients from Asia who have shown the same symptoms. I argued with him. I said, you don't know what you're saying. I grew up in Nigeria. I will tell you. You are an Englishman. What do you know about it? It's a black man disease. Blah, 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 blah. I went on talking, ranting. Poor him. He understood why I would argue and counter what he was saying. But anyway, the test result came and it proved that I had TB. It was a trying time for me because obviously I had my few weeks old baby. I was so ill. I couldn't do anything. I was bedridden for months, like I said earlier on. TB is deadly, especially when you don't diagnose it on time. Had mine been diagnosed at the onset when I complained of the earlier symptoms of coughing and pains, I would not have had to undergo surgery. Unfortunately, the doctors at the time probably had never heard of extrapulmonary TB, so they couldn't suggest that what was wrong with me was outside of my lungs. I paid the price by having to undergo surgery to correct my spine and have some rods put in there to strengthen it and support it. You don't have to pay the same price. You don't have to suffer the same. And that is why I started my campaign, which is known as Be Enlightened about extrapulmonary TB, B.E.P.-TB. It's simply what it says, to tell people that TB is not just pulmonary, it is extrapulmonary. And also to let you know that TB is not a Victorian disease like Amy thought. It is a disease that is still very much here as it was decades ago. TB could be latent and it could be active. Many thousands, millions of people around the world are going on living their day-to-day lives with latent TB because it doesn't really bother them. And it shouldn't, because it's latent, as the name suggests. It's not harmful. The mycobacterium could be in them, but because it's not active, it doesn't have any effect on them nor on anyone. The problem sets in when the TB becomes active TB, and that could be brought about as a result of illness, low immunity, like I believe it was in my case as a pregnant mom. My immunity must have been low, and so the TB came to light. I don't know how long for I had the TB in me. It could have been for years, could have been for decades. But I had it, and I suffered from it, and that's the truth. But being able to identify the symptoms when you have TB is so important. Many times people have TB in other places, so people have extrapulmonary TB and they don't realize it. Even doctors, like you've seen, overlook it. I've read stories of people who had TB in their joints, in their ankles, and when they went to the doctor said, oh, you've sprained your ankle, and so they were treating them for this thing and for that thing. Another said he suffered from pains in his legs, and for a long time he thought he had stroke. But you know, as fate would have it for him, he met a doctor who was familiar with such a symptom and said, you must have TB, and started treating him for TB. I've read countless stories. Some people have TB in their womb, in their reproductive system. Some have it in their nails. Some have it on their skin. It shows a mass. Some have it in their eyes. Can you believe it? In their eyes, in their brain. There's even TB in the blood. TB can be anywhere. It can be anywhere and everywhere. It's difficult to diagnose, and that is why, you know, I do such campaigns to tell you of the wide range of symptoms that one could possibly depict if infected by the mycobacterium. And it's to also prompt you, if you suspect, that you should go to your doctor and insist on being checked out. The first check is to do a sputum test. And that's if you're showing signs of pulmonary TB. But if the symptoms still persist, after the test comes back nil, for instance, like it was in my case, go back to your doctor, ask them that you need them to do an x-ray, you need them to do an MRI scan, do as many tests as they possibly can. Even blood tests could give, what's it called now, pointers to something wrong. And then it will lead to further tests to be done. And hopefully that can be narrowed down to TB. You don't want to suffer you don't want to suffer and be at the losing end of, oh, it can be TB. Like Amy said, even when her uncle prompted her to go and do a check. Had I known that there's anything called extrapulmonary TB, knowing who I am, I would have insisted with my doctors. I would have fought with my doctors to ensure that they did the basic or necessary checks on me. So, TB is here. The symptoms are real. They are varied, but the beautiful thing, the most important thing about everything so far is it is curable. It is curable. So don't you panic. Don't be stigmatized. Don't feel ashamed at all if you think you have TB. For a good while, I was embarrassed to share my story. I was embarrassed about telling people that I had TB because of the impression people have of this disease. But would I rather see people die because of TB or because of the ignorance they had about TB? Or I would prefer to inform people about this deadly disease, signs they could look out for, especially when it's extrapulmonary TB. I chose the latter. I remember about this time last year, I was in Manchester speaking to a cross-section of women and men. And after I told them about my story of TB, my experience of TB, and afterwards a woman came to me, she was tear-eyed, and she said her brother died. And she's almost sure that he died of TB. It was a Ugandan lady. She felt so sad and she thanked me for the information, but wished she had met me months prior to that. Because if she had, she would have immediately asked her brother to go and do some more checks for tuberculosis. When I launched my book, which is titled Not My Spine, the untold story of the cause and the cost, a man came to me and told me how he suffered from TB. But for about 4 years, nobody could detect it, not even his doctors. But it took a long time. He lost his job because he was so ill, so sick, he couldn't go to work. It took 4 years for his TB to be diagnosed. I've received messages from people from all over the world who have written me, told me different experiences they had of TB, how it was overlooked for many, many years. Some are suffering badly as a result of the consequence of not detecting it early. A few of them had theirs detected out of sheer luck. So I hope that I have been able to enlighten you about tuberculosis, about the variants of TB, which is pulmonary and extrapulmonary, about the symptoms of pulmonary TB and extrapulmonary TB. And let me just say here, the symptoms of extrapulmonary TB is varied, depends on what part of your body it affects. But most often it ranges from mild to severe pains, inability to walk, especially if it has to do with your limbs. It's the symptoms are so many and broad, I would say. But if you have them, if you begin to change your mindset first about TB being here, and you have a bit of knowledge about some of the symptoms that one could show if infected, that will be your first step to getting the right treatment. And just to repeat a word of caution, when you take your TB medication, please take it for the full course as advised by your doctor. Amy took hers for 6 months. I was told to take mine for 9 months because of the extent of damage. As a matter of fact, I was too scared to have it come back again, so I asked that it should be lengthened to 1 year. So I took mine for 1 year. It wasn't the best. Like Natalie said, she hated taking medications. Who does? Who likes it? I didn't like it. I took at least 16 tablets every day of my TB medicines. It wasn't a nice experience to put all that myriad of medicines down one's throat, but I had to take it. So make sure you finish the full course of your TB medication, because that reduces the chances of it coming back. I am grateful. I am very grateful and fortunate that after 9 years, TB hasn't come back. Some people have had it different because they didn't finish their course of medication like Amy. Some people's body become prone to TB treatment, and such is termed multiple resistance to TB. Their body become resistant to TB. And one of the reasons is because they don't finish the course of the treatment. There are other reasons, of course, but you know, why don't we do the bit we can to get a good life, to get well, while we can, when we know what to do? So I hope I've been able to encourage you, inspire you, and most importantly, educate you about tuberculosis, the symptoms, and that it is curable. Thank you very much for listening, and I would love to hear from you. If you can send me an email on esosaicolo@gmail.com. I'll say that again, esosaicolo@gmail.com, or leave a comment at the bottom of this video. I'd love to hear from you, and I'll do all I can to respond. Thank you.